yours, Valisa TV. So, I just got off of work. So, what y'all finna get is just my raw, unfiltered feelings about this thing called nursing. So, I go to work. I'm supposed to work my 16 hours today. And there is a particular floor in this facility that I am not supposed to be. I don't want to work there. Me and the nurse manager, we have butted heads because, quite frankly, and this is just me and what I've seen, she's a dummy. People get in these positions and they know somebody, and hey, they get them in these positions. Let me see. Hold on, let's see if I can make this camera close up. Ooh, 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 ooh. Nope, maybe not. I'll just sit like this. So I'll tell you some of the issues I've had with her. I've had issues where narcotics were being given and the order was discontinued. And because the person that was giving the medication was her friend, she decided that she was going to try to come for me. And the one thing that I have been taught with the education and the experiences that I've learned from in Texas was to CYA and know your stuff. Unfortunately, being a person of color, I mean, we just have to know our stuff a little bit more and a little bit than others, because we do not get the slack. We don't get, oh, you know, she made a simple mistake, or she didn't mean it. No, everything that we do, whether it's a mistake, whether it's a patient complaint and you were in the right, because for me, the issue I run into is I'm taking care of a patient and I do my teaching, and the problem lies when everybody is not on the same page when giving medicines or even with the teaching, to the point where they're not even teaching, to the point where they're not doing blood pressure and checking these people's pulses, medicating them with their, ACE inhibitors or their whatever other prescribed medications. We're not afforded that. We're not afforded any type of room for error. And because we're not afforded room for error, I make sure I stay on top of my stuff. But even with you staying on top of your stuff, when you work in a place that is been operating to a level of they don't give up crap, it's hard. It's hard. I wish I had the ability to turn off my ability to care for these patients, to be an advocate for these patients, to do right by these patients. I would know, you know what? I'm not gonna say I wish I had that ability, because if I ever had developed that ability, then I need to be getting out of the field. And that's what a lot of nurses need to be doing, is getting that out of the freaking field, because I am just tired of working in mess. So, go back to what I was saying. This particular floor, I don't get along with the freaking nurse supervisor. She got upset because of a couple of issues. Now, narcotic was one of the issues, but there was some other stuff that was going on that I brought awareness to her. So, in her doing that, she decides she wants to like nitpick and think she can talk to me any kind of way. I have had to sit. And I ain't gonna say I have to sit. I have sat there and watched another nurse talk about me. Don't know me from Adam or Eve. Just know that I was new to the facility, and she just assumed that I didn't know how to do an admission for that facility. She didn't get to know me. She didn't do any of that. I'm standing there and I'm listening to her talk about me. And I wish I had my glasses, because when she was doing it, I put my glasses on. And like an old person, I just kind of looked over my glasses. Now, the nurse manager, the one I don't get along with, she's looking at me. She was like, it's okay. And I'm like, no, it's not okay. No, it's not okay. And that was just one of many other situations where I had to bite my tongue. And I had to bite my tongue. Why? Because I am black. And if I say something, whether it's in a stern way, and I'm not yelling, raising my voice, it's going to be looked at as I'm an angry black woman. That's what it's going to be looked at. And I'm just like so over it. So I've been working this other floor, and it's so funny because when I went to this other floor, you see a total difference. Things are together. You ain't got to worry about no narcotic issues. You ain't got to worry about medications being reordered. Like, everybody stays on top of that. And you know, I go in today and I'm sent to that floor that I'm not supposed to be on. Now, I told the house supervisor, who I've already complained and just shared that, you know, whatever issues I bring to her, she don't do anything about it. There's a couple of them like that. So I told her, hey, what am I doing down here? I'm not supposed to be here. And for reasons that you know and I know, like, I'm not supposed to be here. I don't get along with this manager. So she was like, oh, you know, it's fine. You can, it's fine. So I'm like, okay, you know what? I know she wrong, but you know what? Let me just do what I need to do. So now I'm on this floor. And when I tell you it's a difference and how the other floors are ran versus this floor. And this floor is their money maker. It is the Medicare hall. It's the rehab hall. It's the floor that, you know, people come in and they're there maybe a little bit longer than the traditional week or 2 weeks, or where they have to do, 4 to 5 hours of rehab. They may have to do a little bit less, and the stay may be anywhere from, 2 weeks to maybe 2 months. But I come in, I get report immediately. I'm just like, okay. It's been, I haven't been down there. Some of the people, most of the people I did not know. I was getting a late start because the other nurse prior to me was, running behind. So here it is. I get started. And then, of course, who comes? Pharmacy. Pharmacy seems to always come at the most inopportune time when you're busy and you're trying to get started. So I had to stop and take care of that. And so, it was good because, my patient had a narcotic and she was having some pain. So I was like, okay, I can be able to give her, a pain pill. So I'm working and I'm looking. So the way they do things, which I wish they had a freaking scanner. I wish they had a scan system. Because this handwriting crap is for the freaking goddamn birds. When they check in narcotics there, they have a whole sheet. We have to write the person's name, the prescription number, how many, when it was signed in, and then we add it to, because they count the narcotic cards or all of it. So we count all of that to make sure that you have the right number of narcotic sheets and cards that you're supposed to. As the narcotics are being used, you're supposed to pull it out, go through that form that you write all the narcs in, and kind of take a highlighter and then, you know, take it away, and then you do your subtraction or your addition. Same when they being admitted. Oh, sorry, Daddy. You do the same thing. So I get my patient. I have a whole haul. And for y'all know, I work in a nursing home. It's been a while since I worked in a nursing home, and I can see why I stopped working in a nursing home. I'm not saying all nursing homes are bad, but I can tell you this: if it's not together, you just, like, every time I work on that floor, I just feel like my license is I'm just waving by. I'm waving by to my nursing license. So there were several things I found. One, nurses were giving a person narcotics without a frequency order. So the order read, Destiny, if you don't calm down, what the hell is going on? What's going on? What's going on, Stank? What? I'm trying to do the video. Let me do the video. Here we go. Okay, you let me do it. Let me do it. Thank you. So the order read Oxycontin IR 5 milligrams, PRN. What's wrong with that order? PRN. That is what was in the computer. So I'm like, okay, this is not a complete order. How frequently can the person have it? And the reason is because the patient was asking for the medication. And I was like, I need to do some digging. So as I do some digging, the prescription had on it Oxycontin IR 5 milligrams Q twice a day PRN as needed for pain. To me, twice a day means every 12 hours unless the doctor specifies what times he wants that, or range of when he wants the medication to be given. Otherwise, I'm not going to assume what you expect twice, the hours that you want twice a day. So I'm going to go off what I learned at school. Twice a day means every 12 hours. Okay, so as I'm looking at the prescription, it says, once again, Oxycontin IR 5 milligrams PO BID as needed for pain. I look a little bit further down, and on that same prescription pad, it had, I cannot think of the pain patch that he had ordered, but it stated, stop the tablet, the pain stop the PO pain medication once the patch came in. So you got nurses giving the medications without a frequency. You got nurses continue to give that medicine when the patches came in. Now the patient is telling me that he don't want the patch and he's been refusing the patch. And then my question to him is, did you discuss this with your doctor? Because nobody else has said anything about it. He said he has. I'm like, well, on his prescription pad, this is what it says, and it's kind of what I need to go by. And if you don't like the pain patch, then you needed to ensure that the doctor was aware of that, because from my standpoint, that's not what he's aware of. Now, I don't know this person, so I'm like, okay, you're saying you don't want the patch, so I need to check your body. And he was, of course, he was not happy with that. He was like, why? I said, I have to check your body because you're saying you refuse the pain patch, and you want to take the pills. I'm just trying to make sure. I'm not saying you're lying, but I need to ensure you don't have a pain patch, because at any point, once I call a doctor and he said you can get these pain pills, I don't want you to overdose on me. So he lets me check his body and this, that, and the third. So now that's one problem I need to go take care of. So as I'm again looking through some more orders, I'm noticing I have a patient as I'm giving him his meds, it is what it is, and I'm just like, please, people, stay involved in your family's care, especially if you're a person of color. They don't give a freaking foul about us. They don't. They don't care. They're not going to do the teaching. They're not going to. They're just not. They're not going to tell you what you need to know. They're not going to tell you, the disease process and what to expect if you continue not to take care of yourself. They're not going to tell you about your medications, the side effects, or when you have to hold the med, or when you should call, your doctor. They're not going to do any of that. I do that. I do it for all my patients. But the man was getting chemotherapy. He had at one point been on dialysis, which I didn't get that in the report because as I was doing my assessment. And of course, when you're in a nursing home, you don't do really a head-to-toe assessment. I think you fill out you do it initially, but I know they didn't talk about that he had a fistula in his left forearm. As I'm doing my assessment, I can feel it, positive for brewery and thrill. And I asked him about it. He said, yes, he was on it at one point. He's not anymore. Then I went on to ask him, I was like, hey, so you're still getting chemo every day? And he said, yes, he gets it a couple of times a day. So for me, I am not an oncology nurse, but I've worked on an oncology floor. And I know that if a person is receiving chemo, we know that when you're receiving chemo, that knocks out your, oh God, why I can't think. It knocks out your immune system. So you're at higher risk for being infected, from flu or pneumonia, like any of this stuff. So you just have to be very cautious with them. Now, it's funny that they had the chemo bags, like the yellow bags for when, if he urinates or like those type of waste things. But what they didn't have was the reverse isolation that a patient is normally on, that I'm used to when they are actively getting chemotherapy. So I go get the setup and I talk to the patient. I say, hey, listen, if anybody comes in your room, you make sure, and they're doing any type of care, they're in your face, you make sure they have a mask, gloves, and gown. I put the sign up on the door. I talk to the nurse aides about it. Boom. That's another problem. taking, dealt with that. Then got another issue with another patient. Well, now I haven't been on this floor, and so when she gave me reports, she said the patient had an NG tube, and I was like, oh, okay. And then she was telling me that the patient is supposed to get tube feeding, but she doesn't know what type of tube feeding, but she was on clear liquids. And I was like, okay, I'll try to see what I can get and look, figure out about that. So I go and I look at the patient. I'm gonna need people, if you don't know the difference between an NG tube and a DOPOF, you could be new. That's fine. If you don't know, don't give it a name. Go ask somebody before you give it a name. But these are nurses. That nurse apparently is experienced. You tell me it's an NG tube, I don't do my assessment. She has a DOPOF, and it's bridled in her nose. And bridled mean that she has a little, it's not suture, but there's like, it is a piece that goes goes through the hole in your nose and to the other side, and they kind of put it together so it won't slip out. It stays in place in your nose. So I'm like, okay. Then she has a PICC line in her right upper arm. It looks like it needs to be changed. She doesn't have a cap on the port, and she gets antibiotics, and she is also a cancer patient, but I don't think she gets chemotherapy or radiation, but she's definitely a cancer patient. So I'm just like, okay, I only have 8. Okay. I'm like, okay. So I'm cleaning, her PICC line, and I'm doing this, that, and the third. And I'm like, okay, let me move on. She wants a pain pill. For some reason, I don't get it. These doctors, when they order these pain pills, and it may be a insurance issue. I don't know. Maybe it is a insurance issue, but I never knew insurance to be ordering. Well, you know what? If it's okay, I can get that. But 3, and the patient's gonna be there. She had been there already. She was discharged to the hospital because she had a fever. From my understanding, I think she went septic, and then she came back, and then apparently she went out again. So she's obviously gonna be there a while. So you doing a supply of 3, and she can have the medication every 6 hours. She can have it every 6 hours. And I'm just like, okay. Just see, what the hell? I'm like, okay. Gave her pain, crushed up her meds. She wanted, so here's the problem. She wants her meds crushed up. Not a problem. We can crush it up. But she wanted it mixed. She wanted me to crush it up and then put it in a big cup of water. Well, for me, I told her I wasn't going to do that. And the reason I wasn't going to do that, because what if she doesn't drink all that whole cup of water? Then that means she didn't get all her medications. And apparently she did have some sort of infection because she was on 2 IV antibiotics and an oral. And one of the IV medications is a pretty heavy duty one. I think it's called daptomycin. I think that's what it's called. Daptomycin. And I'm just like, no, I need to make sure I'm gonna put it in this little 30 ml cup and put water in here, and then we'll stir it up and you take it as a shot, and then you follow up with water. But I'm not going to put it in that whole cup, because if you don't drink it, or you spill it, or you fall asleep, then you're not getting your medicine, and then whatever the situation is going on, it's going to get it's going to get worse. She understood. Boom, sat there, dealt with that. But she's on a light every 15-20 minutes. I think she was just lonely. And then after I said, you know what, I normally get in people's business. I'm not gonna lie. When I'm in the hospital, I get in these people's business as far as to find out what their family dynamics is and what happened. Do they know what happened that got them into the hospital, this, that, and the third. And so I was like, well, let me go see what's going on. So I kind of asked her finally about her family dynamics. And then, because I was like, if she calls so much, maybe she don't, I said, I never see her have any family. And maybe she's like lonely. You know what I'm saying? So she just wants to call to have us in the room. So in talking with her, I find out that she doesn't have any siblings. They've all passed. She doesn't have any close family. She said the family she had, it was her cousin that were 20 miles away. And I was like, girl, 20 miles. She said they live far. I said, what's far? She said 20 miles. I'm like, get out of here. 20 miles is not far. But I understand y'all not close. But I was like, but if something was to happen to you, like, who is your medical power of attorney? And then she kind of told me. But it seems like once I talked to her, she kind of settled down. I maybe she just wanted someone just to talk to her for a little bit. So then that was that. Then patient, another medication issue. Patient wanted something for sleep. She tried to play me. Nope. I read the orders, boo. The order said, the order said, trazodone, 100 milligrams, PO, QHS for insomnia. Good order, right? It was until the order continued. It continued and it says give 1 to 2 tablets as needed for insomnia. Well, that is not a complete order. That's actually not even a good order. That order needs to be it needs to be clarified. The patient, at this point, I didn't even go really look and see if the other nurses were giving her 2 of those trazodones, because the order was only for 100. Now, if you weren't paying attention, the patient was she tried to ask me for 2, and I'm like, no, ma'am, you get 1. So I normally take 2 at home. Well, here you're getting 1. So I gave her that. I checked the order. The original order did say 1 tablet. I don't know if the nurse put it in wrong, but the problem is this: when we're doing these 24-hour chart checks, how's it being? Who's is being missed? It's being missed, and when it's being missed, that tells you everybody's not reading the order, and therefore mistakes can be made. And personally, like I said, I don't like working in situations where there's a big risk for narcotic discrepancies. Like, I don't have time for that. Like, no. The other part of the place don't run that way, but this particular floor is freaking mayhem. Excuse me, it's mayhem. So then also, I get a patient back. He wasn't even gone 24 hours, so technically he wasn't a full admit. We just add him back into the system, and I'm getting a report. So the patient went out for unresponsiveness. The report I got from the hospital, which I'm going to say this hospital's name is called St. Clair's Hospital. It's in Pittsburgh. No, it's in Mount Lebanon, Pennsylvania. It is the worst hospital here. I don't know. It's the worst hospital. I just can't even really it's the worst hospital. I feel like nobody there has a license. That's what I feel. And it's just freaking ridiculous and nuts. So you telling me y'all admitted this patient, he came to y'all because he was unresponsive, and you tell me you found nothing. Okay, what did you do? A urine? Okay, the urine was negative. Okay, you did EKG. Yeah, okay, the EKG was nothing. Was negative. Okay, you did CT. Yeah, CT. You did MRI. Yeah, it was negative. Here's the thing with that particular hospital. That hospital, from me being here, always say they've done this, that, and the third, and they will send a person out knowing they shouldn't even been discharged, and the person has to go right back. I don't listen. I am functioning in the capacity of being in a hospital, and I'm thinking I need to go back to the hospital if I got to sit here and do all this thinking. So this man, he comes back. They say they didn't find anything, and so I'm going through his order. So you didn't find anything. So why did you decrease his lyrica? Okay, because it may make him sleepy. Okay, that's fine. I get that. All right, the man has CHF. He has history of AFib and chest pain. He had a stroke. Why did you stop his amiodarone? Okay. Take a note of that. I get him back. His daughter-in-law is concerned because he's still sleepy. And then I'm like, it's something that they missed. At that moment, I really didn't have time to sit through and go through his packet. I'm like, okay, I'm going to get through that. I'm going to go back. Let me just continue on with what I'm doing. So on top of that, we're short an aide or two. So I'm doing aide work on top of my nursing duties, on top of passing water also to everybody, because nobody believes in passing water to these patients anymore. They don't need to drink no water. Flush their system out for what? No, let's just mess them up even more. Okay. So I'm doing that. And then I called the house supervisor to let her know about the medication issue that I had. Like usual, she don't care. I think honestly, the woman go hide and be eating and sleeping. Like a house supervisor in this facility is like, I'm not gonna say all of them, but the majority, I'm gonna say maybe one or two may do their thing. The other ones, no. So I'm continuing on and I'm passing my meds. A couple other things go on. I'm like, this is crazy. This is crazy that I'm seeing all these pharmacy errors and yeah, I called pharmacy and I asked them. I was like, hey, you know, when I wanted to see what they tell me. I'm like, so I give them the patient's information and all this, and I'm like, okay, so you know, we sent you the script over, and they were like, right, and I'm like, so the pharmacist, when we see y'all the prescription over, y'all look at the script and y'all, you know, verify it. He was like, yeah. I'm like, so when y'all stop checking the script, what is against what is actually in the system, because what was in the system was totally not matching up to what the script is. And at this point, I'm like, I feel like that whoever put that order in is wrong. But then I also feel like pharmacy missed it too. The pharmacist told me we don't look at what y'all put in the computer. Oh no, since when? Okay. Ooh. Hold on, y'all. It's my light. No, in here. Hold on. Hurry up. video. So now I'm like kind of peeved, because on top of that, everybody's, you know, calling for narcotics, this, that, and the third. My new patient, I'm reading through now. I go back and I'm looking through his discharge orders, on top of what, you know, them decreasing his Lyrica and discontinuing his amiodarone. I'm like looking, and you know, they write that he needs to have a follow-up with pulmonology. Well, why do you need a follow-up with pulmonology? For a sleep study. So ding, 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 my mind goes, okay, let me go and look at these labs. Since the man wasn't there a whole 24 hours. He went like yesterday, and when he was back less than 24, the next day. Like, he wasn't even gone the whole 24 hours. I'm looking at his labs. I'm looking at his ABGs, and I'm like, this is why the freaking man is sleepy. He has sleep apnea, but they want to discharge him back to the facility and write an order for him to follow with pulmonology to do a sleep study, which, why you couldn't do that in a hospital? Because obviously the man needs a CPAP. He is retaining CO2, therefore, that's why he is sleepy. On top of, they did discharge teaching on congestive heart failure, and that he needs to be weighed every day, and that he needs to be on sodium restriction. But what is, you tell me, what do you think they didn't put? They did not put how much of fluid restriction he should have a day. And I'm almost pretty sure they ain't even discussed this with the patient nor the family, because this patient drinks so much water. He is he uses the urinal sometimes, but he's a very big man. We have to turn him help him turn every 2 hours, just relieve some pressure. But he, for the most part, he's continent. He has some very few accidents, but I'm just like, are you crazy? So initially I thought, okay, you know what, because the daughter was, you know, concerned. I'm like, well, you know, the daughter-in-law, let me call and let her know. But I'm like, you know what, I'm not even gonna get into that. I'm not gonna practice outside of what I know, and to be like, just be practicing and interpreting things that here in this state you should not even be knowing. Hell, the nurse practitioners don't even know what they should be knowing. They halfway don't want to do what they need to do. They don't believe in talking with these patients and getting a DNR status with them. Like, this state is just very, very different for me, and it's not a state that I can, like, today was the day. Like, I've been telling y'all, like, I'm gonna move, but today I'm like, okay, God, I hear you. You ain't gotta tell me no more. I'm gonna finish out this week, and I'm gonna be, I got to go. I got to go. I cannot continue working like this. When the shift was over, we're counting the medicines, and me moving so fast and things getting happening, I popped out a pill for another patient, but it was the same medication moving. And so when we were doing a NARC count, it was one person had an excess when another one had a deficit. So we had to like fix it. That was a whole thing in itself. Like, I had lost it. I'm like, you know what? Because it, like, that tonight, There was a nurse that apparently gave narcotics but didn't sign them out. But they told her that she needed to come back. And guess how long it's been? 2 days. I don't know of any facility that's going to allow you to come back when you good and ready to sign out a narcotic. At that point, I just had lost it. I'm like, you know what? This place picks and chooses who they want to lay the gamut on and who they want to let slide. I said, this girl gave narcotics 2 or 3 days ago, and y'all allowed her to come back in here to sign those narcotics out. Where do they do that? This is why I don't like to be on this floor. I got to let them know. I said, and I'm gonna ruffle up some feathers because I'm over this stuff. What y'all doing is blatantly racism. And I told the house supervisor, why you want to sit up here and try to make something out of something that's something. Let's talk about you. How when I ask you for your assistance sometimes, you don't come out and help me. Or better yet, how about let's talk about how you sleep on the job. Because I got evidence of that too. Like I was like done. Hold on, what if I get this light back on? If this light lasted a short time, I'm gonna be so mad. Hold on, y'all. I bought this little. Oh, it just goes off. It's timed. Okay. Hold on. Hold on. All right, I'm at it. I don't know. I'm just like over it. And I'm just like, you know what, God, you ain't got to tell me no more. I'm not going to wait till I get me a job on where I'm going. I'm finna just finish out this week. I'm finna write up this thing. I'm finna report some things to the state. I'm finna file a freaking, I'm finna file like, that freaking light don't even stay out long. That's crazy. I'm gonna just, file a, I can't even think. Because clearly what y'all doing is racism. And you're not gonna keep playing with me and on my top. I am not. I said this is the most unorganized, crazy freaking floor. Y'all allow stupidity to happen, but when I come in and I find things, y'all want to make me the bad guy, and I'm not the bad guy. But I'm like, I'm over it. The days are marked. Like, I'm finishing out this week and I'm out of here. I'm gonna put my applications in tonight, between tonight and tomorrow, because when they open up on Tuesday, they don't have my application on their desk. And if I have to just do a local contract, which I've seen a couple, then I'll do that too. But I got to go. But in me telling y'all this story, if you don't learn nothing, oh my God, protect your license, chart. They don't like it when you chart. Put names in the goddamn chart if you have to, because this is your license. This is your license. And don't let nobody intimidate you or silence you when you know you are in the right. A person cannot stand me of color, knowing what I know, having a graduate degree. They have a problem with that. And this manager, she is dumb as a box of rocks. I know Her friend got her that position. And it's freaking sad because the patients are the one that's suffering from this stupidity that's going on. But at the same time, the nurse who wants to do right is also suffering. But you know what? That is the point. I just want to come on here and tell y'all how my day went. It was not good. And just like protect your license. And hopefully, and I haven't said anything, please like, comment, subscribe, share, leave your comments. I hope that once I get enough following, that I have like a panel of nurses and we could talk about different situations from different areas and how what resources are out there to help support us or what we can do. Because this is like, I don't know, this is crazy. And I'm like really, 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 really over this mess. But y'all have a good day. I hope y'all have, well, tomorrow's Labor Day. Y'all still continue to be safe out there. I'm going to work tomorrow. So, yeah. The dumb supervisor want to make sure that I come in to work tomorrow to fix her right for what she did today. Oh, because what I didn't tell you is at 11, she was trying to put me on a different floor. And I was like, I'm not having it. Y'all don't pay. If a float nurse, I'm not a float nurse. You want to pay, you want to leave me on the floor, you put me on the floor and leave me there for my whole time. If you're going to float me every 8, every 4, you need to pay me. Like every other facility does when a nurse or a float, you give extra pay. I'm not finna freaking do it. You ain't finna work me to death. But that's my story. That's it. I'm done. Y'all have a wonderful Labor Day weekend. I will be checking back in with y'all this week. I'm trying to be consistent. I haven't started on my workout yet, and I don't think I will up here because I'm gonna be leaving. So I'm hoping to at least get some footage of downtown and one of the trails. That's as much as I'm gonna do, because I don't like to be outside during the day. But y'all have a good day. Until next time, peace. I love you. Bye.